Welcome everybody to Revive Health's Daily Briefing Live for Thursday, March 26th. This is our 30-minute review of the latest, most important news related to COVID-19 crisis aimed at all of you, health system marketers and communicators. I'm Chris Bevelow, Health Systems Practice Lead at Revive Health and your host for the show. I'm joined as always by Chase Kleckner, who is Senior Marketing Manager at Revive Health, and our show's producer. Hello, Chase.
Hey, Chris.
And we are glad to have back with us Ryan Coliani. Ryan is SVP of Issues Crisis here at Revive Health and our lead on the COVID crisis. Ryan, thanks for joining us again.
Yeah, thanks for having me back.
So just to recap what we do here on the show, we'll cover the latest news on COVID-19 and how it relates to marketing communications, try to provide some helpful resources and share what we're seeing and hearing from health systems and Marcom professionals across the industry. Would love to have questions. We want to make this an interactive forum if we can. So use the question queue at the bottom of your Zoom screen and just throw your questions in there as we go, and then we'll hit as many as we can at the end. You can also use the chat function to talk to other attendees if you want, and we will post links as we refer to them in the chat function as well. But if you want us to answer a question, make sure it shows up in that question queue. Reminder that we're recording all of these and post them by the end of the day. So you can find those at our website, thinkrevivehealth.com, or more specifically, thinkrevivehealth/COVID-19. We have all of our COVID content. We're working on getting this set up in a podcast format, waiting for Apple to approve us as a podcast so that you can access it that way and subscribe. So it will just come to you as soon as we post it. So that's coming soon. Just a couple of reminders real quick. We are not experts on COVID-19 in terms of medical or scientific information. So this is not the place to come for that, obviously. But we do have opinions and thoughts on marketing and communications related to COVID-19. We just always remind people to keep that in context with where you are at, because everybody is at different places depending on your organization and your community in terms of how COVID is impacting it. So just keep all that in mind. So let's move to some news. We always want to start with the latest counts. And we do that because we want to keep that in context, because it impacts how we think about all of this overall as we continue to see cases, unfortunately, rise. That obviously is impacting all the things we talk about. And then eventually, as things start settling down, that will also change how we think about all this. So we use the Johns Hopkins tool. And right now, when I refresh, I'm going to take a chance and just refresh. The global number of cases is almost at 500,000, 495,086, with 22,295 deaths globally. In the United States, we are now up to 69,684 cases, and just over 1,000, so 1,049 deaths. We are third in terms of cases. And a number of folks are reporting that it won't be too long before we are the leader in cases, as China has gotten them more under control. Italy's rate has slowed a little. Obviously, we have a much higher population than Italy, so that's the main reason probably we passed them. So yesterday, we, Chase, I asked, like, a lot of times we try to compare this rightly or wrongly to the seasonal flu. And just understanding how many cases we typically get and how many deaths. And I asked you on the spot to try to dig that up, and you did some great work in that. So do you want to share with what you found real quick on that?
Yeah, so the CDC measures the seasonal flu basically by a season. So from October through May. And this year's obviously influenced by the coronavirus and kind of the influence or additional testing. So in 2018 to 2019, there are 35.5 million seasonal flu cases in the US, and then 34,000 deaths from the seasonal flu. And that's just from 2018 to 2019. So
what was the deaths again?
34,200.
34, okay.
Yep.
Got it. So again, obviously we're not close to that now. Though again, depending on the projections, how we control this, you hear respected healthcare experts, public health experts talk about potentially anywhere between 40 and 60 or 70% of the country could eventually get COVID, whether we test them all or not. Obviously, that would put us well beyond 35 million. That would put us closer to, 100 to 200 million, somewhere in there. And death-wise, we are only at 1,000, and as you reported, in a normal year, 34,000 deaths from flu. Hopefully we don't reach that, but again, the projections would tell us that we probably would surpass that, and potentially exponentially, 2, 3, 4 times that, depending on where this goes, potentially way more than that if it really spins out of control. So just to put all that in perspective, I think that's helpful. Thank you, Chase.
Yeah, absolutely.
So one of the resources we wanted to bring forward, and Ryan, I'll ask you to weigh in on this too, because we've been relying on intel from a company called Turbine Labs since the outset, among many things. We're pulling from many different resources. We have a lot of people at ReviveHealth working on this, but especially at the beginning, when we first started putting out content, Turbine Labs is a company out of Colorado, uses an advanced insights platform, AI-driven, to gather intelligence from all kinds of sources: social media, websites, governments, both local, state, and federal, pulling it all together and then providing a really deep level of intel on any kind of topic. But we had asked them to kind of look at COVID-19 in terms of hospitals and health systems, and they send us a report every day. So just as an example, today's report, and we're asking them very specific questions. As one example, we've been asking them from the beginning what they're hearing and seeing in terms of the impact on supply chain for hospitals and health systems. But there's other things we're looking at. And one of the, they give you top findings right at the top of the report that they call out is that, and this isn't a surprise necessarily, though there is some deeper intel here, doctors and nurses are speaking out about the lack of resources and poor conditions in hospitals. We know that. But there's an online forum that's been established by a nurse who says she's hoping to, quote unquote, expose the conditions and tell the true story. And so there's an actual New York Times story as well that references that. Basically a nurse in New Jersey, and she's trying to compile accounts from all across the country from people on the inside, because from her view, and I think for many of her colleagues, the situation is a lot worse than maybe we even realize. So Ryan, I think that's just one example, but there's a lot of others that just been very helpful to us as we've pulled this together.
Yeah, I think the clinician and frontline staff conversation only continues to rise. It's something that we're hearing about from a daily basis from our clients on how to navigate that. It's a very, very significant challenge because oftentimes there tends to be a disconnect between what the administration and what the health system feels they have and they're doing versus what the frontline employees are seeing. So we know a lot of health systems are sending out daily email digests to their employees, and I think those should continue. In fact, you cannot communicate enough with those internal staff. But we did hear from one health system that talked about how their open rates for physician leaders was close to 70%, but when they looked at all staff, it was closer to 25%. Mm-hmm. So we worked with a number of systems on how do you actually find ways and be creative to ensure that they're seeing that content, whether that is using local leaders, using rounds and those types of opportunities to hear and listen and to share information, particularly as clinicians continue to use social media and other avenues to talk about lack of PPE and some of those things that the broader health system feels they have covered. And so ultimately it may just be an educational piece on where the resources are and how to get them.
Yeah, for sure. And as we move into the next segment of the podcast, we're going to talk about a couple specific ways in which hospitals are dealing with this stuff. But again, invite you to check out Turbine Labs. It's www.turbinelabs.com. They work with all kinds of organizations to help them figure out how to deal with this. So they're working with, international retailers, that type of stuff, not just healthcare organizations, but really great information for them. So thank you to them. Let's go ahead and move into that, Ryan, because one of the reasons we want to have you back is that obviously so much focus on COVID-19 and the crisis itself in terms of the clinical crisis, the crisis from the disease that caused the virus. But obviously, so much, I think, of what we're seeing and so much of what our clients and others in the field are dealing with are what I would term, I hate to, secondary is not the right word, but subsequent crises. So if you imagine, that the COVID-19 is a tornado, it's spawning other tornadoes that are spinning out of this that our hospitals and health systems are having to deal with. And so an example is yesterday we had a question about what we were seeing in terms of the current and potential financial impact on hospitals and health systems from the crisis. And we talked a little bit about that, but I would love to hear from you about what Marcom professionals can be doing in terms of internal communications or issues crisis preparedness related to that issue specifically.
Yeah, and you have really two different audiences that you need to articulate very different messages about when you talk about kind of the financial stability of health systems. So the external piece is important, but the internal piece, as I just mentioned, I think is more important. So we've talked to a lot of health systems over the last couple of days about how their financial modeling obviously is not looking great given the lack of elective procedures, given reimbursement rates for COVID patients certainly aren't meeting some of their traditional, financial performance. And so they're looking at, how do they try to potentially curve that a different direction. And a lot of things that they're talking about, unfortunately, are things like increased flex time for frontline staff, physician compensation reductions, those types of things, since ultimately they're not seeing as many patients as they normally would in a typical week. And so from a communications perspective, that presents a number of challenges because I believe, obviously employees understand the situation that they're dealing with from a financial perspective. But I think one thing I would caution system leaders is to not try to do this piecemeal. Where you may announce a physician compensation reduction one day, you may announce additional flex time the next, and then you open yourselves up to additional conversation and questions. And things that need to be considered are things like, are leadership compensation going to be reduced as well? Are they taking a pay cut? How long are these types of things going to last? Does this go across the entire enterprise? Is it just does this run for all employees? And then articulating why, being very clear about, even if they don't have an answer for this, but when they anticipate things to improve and to get better. And it's okay there to say that, we're going to be continuing to combat this on a weekly basis. On the external side, there's some additional concern there because when you talk to somebody in the general public, they're probably thinking that this is a great time to be a hospital operator. And that, the number of patients that are coming into the system means that hospitals must be flush in cash. And so an educational piece is going to have to be made from an external perspective to explain why, hospitals are losing 30, 40, 50% because of the lack of elective procedures. And then there's also the challenge of communicating about that and the challenges they're facing when portions of the stimulus bill that should be passing tomorrow are making up a very significant portion of that at $150 billion, and future legislative packages are likely to provide additional support for hospital systems. So I think those are the two real big areas that we need to focus on. From the external perspective, I think seeding the ground is important. Now probably isn't the right time to talk about that, but leveraging state associations, starting to think through how you're going to communicate that when the time is right. Especially when you may have to be making some tough decisions with your staff, and that ultimately is going to be public.
Yeah, that's super helpful. And I think, it's premature to be spending too much time on this, but it does certainly, we've already started talking about this internally, how everything we're talking about in terms of cost could change coming out of this. And we knew going into this crisis, hospitals and health systems were increasingly being scrutinized for their role in the U.S. health system's higher level of cost than we would see compared to other nations. Typically pharma and insurance companies have been the villains, and hospitals and health systems, for a lot of reasons, have been now kind of put alongside them. Great chance that that's going to change, should change in terms of how people perceive that. In fact, our CEO, Brandon Edwards, wrote a great post about that, and I think we can provide a link to that, about, we really have to have a conversation about demanding that hospitals are financially efficient, financially, sustainable on their own, except for when a crisis hits. Now, forget about all the money issues and just serve society, which of course they are doing, and we need them to do, and we want them to do. But it is true that you can't really have it both ways. You can't expect them to have 100 ventilators just sitting in a closet ready for a crisis if you also want them to be self-sustaining financially, right? There's got to be a balance there. So not something that we need to dig into much today, but something we're looking at in terms of when this ends and how that changes some perception. So another area I want to bring up real quick, Ryan, is union activity. Obviously, particularly nurses unions have been increasingly outspoken on the dire situation many of their members are facing, understandably, but obviously that can also cause communication issues for hospitals and health systems. So what are some thoughts there? What are we seeing there?
Yeah, it's a really good point, and something that we're seeing an increased activity of, particularly as it goes into things that we just talked about. So as nurses and clinicians and physicians are being more vocal on social media, union organizers ultimately using this as an opportunity to either raise concerns that they have with an existing union that exists in an existing system, or even to potentially try to organize where a union activity may not be present. And so we know that they're using typical kind of tactics that they'll use in other union organizing activities, whether that is staging rallies out front of hospitals, picketing, those types of things.
Mm-hmm.
So how do we have a two-way conversation to address some of the concerns that are being raised? And the majority of these concerns continue to go back to PPE, and making it clear what resources are available, what procedures or policies are changing, where I think the big piece is, where can clinicians go to ask questions with leadership? Where can they get answers? It needs to be a two-way street. We can't just be seeing criticism in media from clinicians or union leaders and respond that way. That's certainly part of it, but how can we kind of address those issues before they become broader in front of those media avenues?
Yeah, for sure. And it's always a touchy area, difficult to navigate, but just increasingly so in this crisis. So, okay. So one more thing we wanted to talk about, and it's just kind of related to not just communications necessarily, but that staff, the nursing staff, our physicians, the people we've been talking about. And we've been spending a lot of time, Ryan, you and I have been in some meetings and some others, kind of thinking about in what other ways do hospitals and health systems need help. And I'm not sure they're asking for this, but I think they should be thinking about it. We see a lot of hospitals and health systems, rightly so, having either internal or even external communications, thanking their staff for the amazing things they're doing, which I'll give you a chance in a second to kind of talk about how you have to think about that and be careful with it too in some cases. But that's fantastic. We would encourage that. But what I think we want folks to think about is we have to move beyond just thank yous for our internal staff, for our physicians, for our nurses. And we think marketing communications folks can really play a significant role there. When we think about what all of us are going through, and then all of the people in a hospital or health system organization are going through, and then the frontline staff, as you hear it described, it's a war zone, it's chaos, it is a true crisis. Folks are going to be suffering from this in significant ways. They are going to have mental health issues, dealing with grief at a greater level as they see increased patient deaths or even colleague deaths coming out of this. You're going to see secondary trauma impact. You're going to see PTSD. These are all real effects of living through a crisis like this. And I think we need to be thinking about what more could our organizations be doing to support that frontline staff. So we know hospitals and health systems are already doing a lot. For example, providing childcare, providing meals, and that is great. But what else could we be doing to support them? And the way I would couch it is, as we've been working with clients, a lot of them are rightly going out to market with fantastic communication efforts around health information, education, or even more so, leading their communities in terms of thought leadership and encouragement and support. But approaching these efforts like a brand campaign, like a marketing campaign, I would encourage marketing communication leaders to put as much effort and thought and process and resources into doing the exact same thing for an internal campaign, going beyond the thank yous to really creating a sustained campaign that is all about supporting that frontline staff. And just like any brand campaign, it shouldn't just be about messaging. It should be about packaging the resources that are already available and looking at enhancing or increasing those. So bringing in additional EAP support, bringing in hotlines with trauma-trained and focused therapists. There's a lot of things that you could be doing, and your HR department is undoubtedly overwhelmed with the things they're dealing with. So marketing communications, how can you support HR in this and really bring that level of effort to the internal folks, because they're going to need it as you move forward this and coming out of it. So that was a little mini rant, but I just think the opportunity is there to really have an impact.
Yeah, I think it's absolutely spot on, because just like any other campaign, if we were doing this externally, it's very hollow if there isn't action and resources that are being presented in front of those clinicians and those frontline staff. So whatever new initiatives or pointing to existing resources can be done, that's the only way this is going to be effective. And systems are going to continue to see additional strains as coronavirus continues to infect more patients and more individuals in their systems. And that's going to present challenges with capacity and those types of things. And hitting those resources now before we get to that point is incredibly important. And so, yes, I think it's very important to have thank you like messages and show the support of the entire system for those that are on the front lines. But it also has to be backed up by action. Otherwise, it ultimately becomes a reputational risk.
Yeah, absolutely. So hopefully folks will start thinking about that level. It also, that kind of effort further shows the value of marketing and communication professionals to support their organizations, particularly in a time of crisis. Most of you already do this kind of work, but I think the level of effort could be exponentially greater if you put your creativity and your muscle behind it, because our folks need it. So, okay, let's get to some questions. We have a question that was posted a little bit earlier, and I want to throw it out there. Wondering what other healthcare systems are doing about the magazines they send out to their community. Let me take a shot at that first, Ryan, and then I'll toss it to you to see if you have something to add. I personally have not heard specifically about that from our clients, though what I will tell you we'll do is we'll put that out to all of our client teams and see if there's something different than what I'm going to say. But your community magazines are a phenomenal tool to use right now. We know that we're limited in how we can reach people because most folks aren't out and about. So some of the channels that we might typically use aren't as strong at environmental, as an example, as they might have been in the past. Being able to reach people in their homes is what it's all about. And your magazine is a fantastic way to do that. And just like we've been talking, over the past week, you have to be really smart and sensitive about the content, the messaging, the tone. It should be relevant. The trick with magazines oftentimes is they're really difficult to pull together in a short time frame. A lot of content, a lot of approvals, a lot of production, printing, mailing. So one piece of advice would be to see about trying to shorten all of that by maybe, if you've got a 16-page magazine, dropping it down to 4 pages so you can get it out quicker and be more responsive. But making sure that what you're sending out is appropriate and relevant to what we're dealing with. So as with everything else, you don't want to be promoting elective surgeries in a magazine if you're not able to deliver on them. You don't want to be talking about the importance of eating healthy without referencing COVID in those articles, because they're going to sound out of touch. So from our perspective, I think we would say a great vehicle to use, just use it appropriately and see what you can do to get them out quicker. Anything you'd add to that, Ryan?
No, I'll echo it. I think that there's a pretty significant opportunity here, given where most people are staying at home now. This might be an opportunity for us to really reach them. But it also goes back to all the things that we've talked about in this forum over the last 2 weeks, where it needs to be thoughtful and it needs to strike the right tone. So no different than how you are shifting creative buys and creative campaigns to focus more on COVID versus service lines. The content that you're going to be putting out in any magazine needs to match that. And again, it needs to be flexible, and probably more flexible than some of your creative buys, just given how quickly the situation is evolving on a day-to-day basis. So the call to action in your content can certainly continue to drive to microsites and those types of places, but recognizing that, you know, with a magazine, you obviously typically have more lead time, and that ultimately can present some challenges once it actually is in mailboxes.
Right, exactly. All right, perfect. Well, I think it's a good place to wrap. So let's call it. If there's something you would like us to cover tomorrow or in future podcasts, please let us know. Put that in the chat channel. Also, you can email me at cab@thinkrevivehealth.com. We're working on a response mechanism on our website in our COVID section, but at the least we'll have my email there as well. Thank you so much again, Ryan, for joining us. We'll probably have you back next week as well, if you're open to it.
Happy to do it.
That's great.
Happy to do it.
Chase, thank you, sir, once again.
Always. See you tomorrow.
Yes, for sure. Tomorrow we're going to have Jen Webster, who's an associate creative director at ReviveHealth. She's going to review some recommendations we've pulled together for clients in terms of sensitivity and appropriateness. What Ryan and I just talked about in terms of external communications, specifically around visuals. She gave me an example today that I'll let her share that makes your eyes roll a little bit. It's kind of almost unbelievable that some of the stuff that's getting out there. We kind of shared last week the idea that should hospitals and health systems really be using giant full bleed photos of the microscopic virus to lead their COVID information, because it seems like a kind of scary visual to be using for patients. So she's going to talk at a deeper level about that. So looking forward to that. Remember to visit thinkrevivehealth.com/COVID-19 for all of our COVID information, for a recording of today's episode, which we're going to have up later this afternoon. And remember to let others know about this. And once again, our sign-off messages, hang in there. Keep doing all the great work you're doing. Communications is so important to helping us all get through this, helping your organization get through it. So keep up the great work that you guys are doing. We will be back tomorrow and every weekday until this all passes. So we will see you then. Thanks for joining.